All right, thank you, Dr. Godwin, and thank you all for coming tonight and taking time out of your schedules to hear a little bit about what we're doing and share your perspectives with us on this really important topic. I want to be talking with you to set the stage about protecting health in a changing world. As you know, we're ultimately all about our students. And the students that we're going to be graduating in a short while, the end of this quarter, are going to start a career in 2020 that will last to about 2080. And over that course, they're going to face some really dramatic challenges that none of us has faced previously. The population of the world is going to grow on the order of roughly 2 billion. The world is going to continue to warm. We'll see about 4 degrees Celsius of warming, most likely by 2080, perhaps more. That's about 7 degrees Fahrenheit for Americans. We're going to see hundreds of millions of people migrate. And I think we're really going to struggle to adapt. And I think our students are going to be faced with a lot of challenges that they are not expecting currently. And I want to make sure that we are in a position to train them so that they're ready to help think this through with their communities and protect health, protect equity as they move forward. I'm going to tell you a little bit about what's happening in the world here in Washington, how it affects health, and how some of our team here at UW is engaging with these issues, including Edmund and Gino. And again, set the stage for later discussion tonight. These are some projections for temperature and precipitation in Washington state through the end of this century. There's a high emissions and a low emissions trajectory. The high emissions is the one we're on. It's the one we've always been on. Despite our rhetoric and recent investments in reducing emissions, we are likely to continue to be on some version of this high emissions pathway. So that's the one that I would focus on. And what you can see is by the end of this century, we're likely to see about 10 degrees of warming here in Washington. And we're likely to see about 10% more precipitation than we usually get. You also can notice that the squiggles around the central line get wider, and that's because we are seeing more variability. And that variability translates into things like drought. So this is a long time series, shows you from roughly 1890 through current times, the pronounced droughts that we've seen in the West. And they've been getting worse. You see these periods where they've now become pretty routinely severe droughts. We're not in a massive drought right now, but you can bet that we'll continue to see this pattern going forward. Similarly, we're seeing a reduction in our snowpack, and we're seeing changes in a lot of things that we have historically taken for granted and presumed to be relatively immutable in our region. It's not so. Our snowpack is rarely at its full usual level now. And increasingly, this is because it's not because we're not getting the precipitation, it's because it's not falling as snow. It's falling as rain. And as we enter into the second half of this century, we're likely to be in a rain-dominated regime in terms of wintertime precipitation, which has massive implications for our water quality and quantity, not to mention agricultural activities and other things. One of those other things is flooding. As we see more precipitation come in the form of rain, we have more runoff in our drainage systems. That, combined with sea level rise, threatens our low-lying areas. And you can see several of them here. This is a map of our region with sea level rise at 4 degrees Celsius. So again, roughly 2080 or so. And you can see that many of our large drainage systems in Everett, in Seattle, in Tacoma are all threatened. And we're taking some steps to protect the ports and infrastructure in these areas, but there's no question that these communities are going to be significantly affected. There are a lot of important equity issues to consider here. Climate change ultimately can impact human health through almost any pathway you can devise. And I'm not going to go through each of these. I do in a whole quarter-long course if you're interested, but tonight, the point I want to make is that we're facing an unprecedented set of challenges related to these new environmental impacts. They can affect populations in many different ways, depending on the underlying health of that population and the hazards that it faces. And the things that I'm particularly concerned about are in the bottom left: malnutrition, diarrheal disease, and the more indirect pathways related to conflict and migration. And ultimately, I think climate change is one of many determinants of health that we need to be focusing on and thinking about. I spend about half my time working at Harborview, work in the emergency department. One of the things that we do down there, it's a nice place to practice emergency medicine because it's a very socially oriented, mission-oriented system. And in addition to making sure that the medical needs of a particular patient are taken care of, before we send somebody out into the world, we make sure that they also have housing, that they have the food they need, and that somebody loves them. And that is threatened by what's happening. All of these changes potentially undermine our ability to provide those needed services. And as a country, we're going to struggle with this. This is a projection of impacts and of losses, financial losses as a percentage of GDP for the country by county by the end of the century. And the pattern's very clear. We're going to be facing pretty massive losses, particularly in our southeastern coast. We're going to see a lot of migration from that region, and it's going to be going from the areas that are red to the areas that are green. We're in an area that's green, and we've already struggled with a lot of migration up to this point, and I think over time, later in the century, we may well struggle with more. We may also struggle with other really difficult risk management decisions that have to do with risk transfers between the parts of the country that are less affected and the parts of the country that are deeply affected, as well as the challenges associated with other countries, which no question will be much more affected than we will. And I'm speaking to you tonight as part of a very large team, both within the School of Public Health and the School of Medicine and across the university. We work together to assess and map and consider these risks and think about options for responding and how those options might protect health. Because to be frank, we really have not invested to this point in assessing opportunities to address these risks because we haven't been thinking about them the way that we need to. I'm going to give you a few examples. We have worked on agricultural activities and heat exposure of migrant workers in these settings and looking at their incentive systems for production in orchards. And we are one of the few states that actually has regulations related to agricultural activity and heat. They're still not enough, but they're a great start, and it's based in part on the work we've done here. We also partner with the College of the Environment and with the State Department of Health, focusing on aquaculture and looking at Vibrio parahemolyticus in shellfish, not only to protect those out there who like to eat oysters and other shellfish. I'm not among them, but hats off to you. My wife is certainly one. But also to protect that industry, which is very important to Puget Sound. And it's part of the first foods, and we want to make sure that our tribal partners also have sustained access to safe first foods. Which leads me to another set of projects that we're focusing on with the Swinomish tribe. They have received a grant from the CDC to do work translating the climate change adaptation model that I helped develop when I was there to an indigenous setting and develop health indicators that resonate for them because the health indicators that we use conventionally in public health don't have nearly as much meaning as to them as they do to us. And so they've identified a whole host of different approaches to identifying and tracking relationships between the environment and the climate and Swinomish lifeways and first foods and other things, and developed indicators to track. And I'm proud to say we're actually getting a site visit from the Robert Wood Johnson Foundation next Friday to as a finalist for a large grant related to investing in this and developing it for other First Nations around the Pacific Northwest. We've worked on drought and wildfires. We work with the College of the Environment to map areas affected by drought and impacts on forest health. And we work within Department of Environmental and Occupational Health Sciences to map out wildfire risk. You're going to be hearing some about this from Edmund. And building community perspectives and resilience and ability to respond to these, anticipate and respond to these hazards, and also to develop interventions to protect people's health from a respiratory standpoint when fire smoke comes, which unfortunately we right now don't have very many effective interventions at all. So we need to know what the options are and how effective they are. We need our students to be prepared to build resilience. They need to understand what kinds of mitigation opportunities there are. How do we reduce our greenhouse gas emissions in a way that protects health and maximizes the health protection available with climate change mitigation? We also need to know how to start and maximize our adaptation opportunities. Those things together will enhance resilience. And I look forward to a conversation with you later about how we can continue to educate our students around these topics and prepare them to deal with a set of things that we have never seen before. So thank you.